weeks typically.
And you aren't going to have radiation.
Yeah,
So
probably not if you're
I
not.
had the 131 where you take the pill.
Oh, okay, no,
Radiation.
I was
You cut
radiated
her
external.
Yeah.
So once I recovered from all that, we started on the voicing track, and a little difficulty in the beginning, then started
So
to
you
get
had
it.
to go for voice therapy?
Yes, with somebody like me.
Somebody like Ann?
Yeah. I did.
What did that person teach you? How to breathe? How to...
No, you have to learn how to occlude and get a voice again. Because the way the prosthesis works is, that is,
Yeah, that's your stomach.
right, but in the back it's the prosthesis.
Right.
So as you saw, in order to talk, I have to either use my thumb or a freehand spout. So all you're doing is you're blocking the air coming out the trach. It goes through the prosthesis. On that air, then I'm voicing very much like you guys do with the larynx. It's just that your trach is typically that big.
Yeah.
And your vocal folds are on top of it. I don't have the vocal folds. I have the trach that big, and now it's at the neck, but I can only push air through something that big. So I just have no volume. This is as loud as I'm going to get.
I have trouble getting people to understand me right now because my...
It's very whispery.
Yes.
I would think, all things being equal, you can develop a voice like Rita where...
Get stronger?
Yeah.
hers is quite strong.
Rita's?
Rita's
Yeah.
was, yes.
Yeah.
Rita's very good.
But it still sounds kind of
Raspy.
raspy.
Well, sure, you're not going to get away from that. You don't have vocal cords. What your vocal cords do when they vibrate, and they're vibrating at about 4,000 beats per second, is they put a frequency in the air. And that frequency gives you your voice. But if you notice, Rita and I sound very similar.
Yeah.
Because we don't have the ability to create that frequency range that would separate our voices. A male's vocal cords are a little further apart.
Yeah.
Females are a little closer together.
Closer.
And that's why your range is
it
up
higher?
here and we tend to be down here.
Down here, lower.
And so what happens is we're all pretty much equal as a laryngectomy. Now, I know women who, over time, actually start to develop more of a feminine voice. And if Rita wasn't on the phone trying to communicate, if she was sitting in the room,
Yeah.
where we can take the pressure down a little bit,
Yeah.
her voice quality starts to sound a little more feminine. But you're going to be typically a little bit louder than you are now, and a lot of it is you. You know, this is what my friends are telling me. They know it's me because my personality comes out
Yeah.
in my voice, and so,
They,
oh, no,
they
that's
know it. They know it.
you know, I can...
They're not looking at. I'm not looking at your.
Right, they're not listening to the exact sound.
Right.
They're
listening to
the
you.
words.
I'm
Right.
listening to your voice. I'm not listening to
Right.
any of what somebody would call a defect, but it's not.
Right.
Yeah, it's.
Now, the thing is, when I haven't seen somebody for a long time, even family, there's oftentimes a little bit of an adjustment where they're processing the sound more than anything else. But a lot of those people, the first thing they say is, wow, you sound terrific. Are you doing something different? Nope. They're just not used to it, so they're getting it as something kind of like new, and then realizing it's really not that bad. So,
When you were diagnosed and the doctors told you that you needed to have a laryngectomy, was there thoughts in your mind that, do I want to do this or not?
no. It wasn't really an option.
It wasn't an option?
No, not really.
Why?
was
Because
life.
the tumor on this side was the size of an egg. I would have suffocated in probably 6 months.
See, that was mine was suffocating me too.
Yeah. I
And
mean,
it's
so,
It's like my brother John. He, as towards his end, he couldn't talk. It was had to swallow and then speak. He had a feeding tube, but he had a
Right.
different type of cancer. But
yeah, so I was given less than a 30% chance to survive the first year.
Without the surgery.
No, with surgery.
With surgery?
With surgery, yeah. That was not an option. In fact, I told the doctor, I don't really care about all this planning, just take it out. Because I knew if they didn't take it out, I didn't have a shot. I don't know why I knew that. I just knew that. So I told him, just take it out. Because I don't have a
My
chance if you don't.
problem is that I don't know if I want to live the rest of my life with having to deal with it.
Well, what's the prognosis if you don't do anything?
The cancer will grow.
Well, then you know the end result of that. So it's the short cycle or potentially longer cycle. It's up to you. I mean, this to me, my perspective, life is fabulous, and I wouldn't be able to enjoy any of it if I didn't do the surgery. I wouldn't be here, or the quality of life would go way down. I don't have a problem eating. I don't have a problem with food. I don't have a problem swallowing per se. I've had to make adjustments, sure, but not that big a deal. I don't swim. I was a big water person, but that's just not worth the risk, so I tend not to. Like I said, I ride a motorcycle. I do a lot of stuff.
Why does that go in and out?
Because yours goes up and down. Because your larynx is doing this when you talk. Now that I don't have that, and the traits at the neck, mine's doing this, and we just shifted directions. That's why, because the pressure is to cause this to occlude, and then voice on that. So laryngectomies go this way, and face breathers go this way.
So you don't have any trouble sleeping?
No.
Sleep on your side? Sleep on...
I don't because of a back issue. I do occasionally catch myself on my side, but my back is such that...
How about other patients that you've been with or seen?
Right.
They have their sleeping patterns. I mean, do they have
change,
to...
They're fine.
They can lay on their sides and do any of that.
For the most part, I mean, there may be... Everybody's different, so...
Yeah, elevating heads.
I think the question is, are there any particular sleeping problems related to a laryngectomy? And I would say no.
No.
Right? I mean, you may have your own little thing that's different, but just because you're a laryngectomy doesn't mean you're going to have a particular problem.
Because I know at Emperor right now, she has to be elevated.
I sleep in a bed
That's
adjusted, and I sleep on my back.
Right, but you need that because of your current condition.
right.
You know, see, that's the other thing. As a neck breather, you're working harder breathing than I am.
So what happens if we, like now I'm breathing through my trach, through my pacemaker. Normally, like her, she breathes through her nose and her mouth. We don't. So
right.
what happens?
I don't. I think you
no,
still
I won't
could.
either. No.
When she has
If
the
I have,
voice box
like
out.
now I'm not breathing through my nose or my mouth. And if I have a laryngectomy, I won't have.
Right.
So what happens with, like, when you have a cold?
You tend not to get colds if you're not breathing through your nose and mouth. Because the cold starts in your nasal system where it's warm and moist. Because we're not moving air through there.
Getting the warmth.
Right. So, with the bacteria may be in there. It's got nowhere to go because it can't get into the lungs.
Okay.
Because it's physically separated.
So you don't
So
So you're healthier, in essence,
Generally,
than most people.
you might get more of a chest cold. Everybody's a little bit
Have you had any
different.
problem with your lungs?
No, I haven't.
How often have you been sick in the last 14 years? I mean, with a cold or virus or anything.
Maybe once.
Wow.
I mean, I have no idea. Because I've noticed on occasion that maybe I've got a little bit of a chest cold, but nothing that's laid me out, nothing that's knocked me down.
How about traveling on the airplane or altitude or anything like that?
I just got back from LA last night.
Why?
I went down Tuesday, came back Thursday. I do that all the time. Been to Europe, been to Canada.
Yeah, being up in the air doesn't
Not me. I mean,
doesn't stop you.
No. And
Doesn't
if
like
you didn't have a
anything
problem
stop you.
flying before, you probably won't have a problem now.
No, I didn't.
So, and who's the surgeon that's doing this?
Dr. Sunwoo, John Sunwoo at here at Stanford.
Yeah. Right.
But the doctor that did my surgery is in Stockton. That's where I live.
Right. And then he referred you over
He
here.
referred me here because he said the only thing to do is to have a laryngectomy. And I said, I want other options and I want a second opinion. So he told me to come
Well,
here.
that's good to get.
He
yeah.
said, doesn't bother me if you want to have a second opinion.
I think when you're looking at this,